Hey everybody, Sarah here with Healthy Foods Heal, here to talk about a very important topic, kidney health. We all indulge in bad habits from time to time. We're only human after all, and we do our best to avoid bad habits. But what about the ones that we don't realize are bad? When it comes to preserving our kidneys' health, we often overlook common habits that seem benign. Could you be harming your kidneys without realizing it? In the US, kidney disease may affect over 20 million people, many of whom are unaware that they have it. A dangerous ailment, kidney disease can impact your heart, bones, immune system, and even your brain. Severe instances may potentially result in renal failure, necessitating dialysis or a kidney transplant in order to survive. The good news is it's not too late to unlearn these damaging behaviors. Here are a list of 12 common habits, and one bonus at the end, that you might not realize are putting undue pressure on your kidneys. First on our list, missing out on sleep. A good night's rest is extremely important to your overall well-being, and it turns out, your kidneys. Kidney function is regulated by the sleep-wake cycle, which helps coordinate the kidney's workload over 24 hours. When you sleep, your kidneys reduce their workload, resuming their normal function when you wake up, filtering more blood. Your kidneys' balance and efficiency are preserved by this cycle. Your circadian cycle is thrown off when you don't get enough sleep, and your kidneys can't function at their best. People who slept less than 5 hours per night had a 65% higher chance of getting kidney disease than those who slept 7 to 8 hours per night, according to a study published in the Journal of the American Society of Nephrology. Try to stick to a regular sleep pattern and stay away from heavy meals, coffee, alcohol, and nicotine just before bed to enhance the quality of your sleep. To establish a cozy and dark resting environment at night, limit the amount of time spent on screens and bright light exposure. Next up at number 2 is excessive salt intake. While salt is very important for your body, too much of it can be a bad thing. Salt helps to maintain fluid balance necessary for nerve and muscle function, but too much of it can be very bad for your kidneys. Water retention is brought on by sodium, and the two together will increase the amount of blood that passes through your arteries. This causes your blood pressure to rise over time and increases the amount of work your kidneys have to do to eliminate excess fluid and sodium from your body. Additionally, high blood pressure might weaken your kidneys' small blood capillaries and lessen their capacity to filter blood. It is, in fact, one of the primary causes of renal failure and damage. How much salt, then, is too much? According to the American Heart Association, the average American diet contains around 3,400 milligrams of sodium daily, primarily from processed foods like frozen dinners, canned products, and salty snacks that are rich in sodium. That amount is far more than the FDA's suggested daily maximum of 2,300 milligrams, or roughly 1 teaspoon of salt. To reduce your sodium intake, read nutrition labels carefully when buying packaged foods, eat more fresh fruits and veggies, and cook your own foods whenever possible, rather than eating canned frozen meals. Flavor your foods with herbs and spices instead of salt. Over time, you may find it easier to avoid using added salt, sodium, on your food. Coming in at number 3 is eating processed foods. Foods that have undergone modifications from their original condition, such as the addition of sugar, salt, artificial tastes and colors, or preservatives, are referred to as processed foods. They can be tasty and convenient, but they are also extremely harmful to your kidneys. This is because processed foods include high levels of phosphorus and sodium. If taken in excess, these minerals can result in kidney stones and elevated blood pressure. Your kidneys are strained by high blood pressure, and kidney stones are painful deposits of minerals in your urinary system. A study that was published in the American Journal of Kidney Diseases found that those who consumed more processed meals also had higher blood levels of phosphorus, which over time can cause kidney damage. Many people who have kidney disease need to limit phosphorus in their diets. Some studies have shown that high phosphorus intake from processed foods in people without kidney disease may be harmful to their kidneys and bones. Number 4 is a simple one to fix: not drinking enough water. Staying well hydrated helps your kidneys clear sodium and toxins from the body. These waste products can accumulate without adequate water and cause issues like kidney stones and chronic renal disease. Drinking lots of water is one of the best methods to prevent kidney problems and maintain healthy kidneys. Those with kidney problems or kidney failure may need to restrict their fluid intake, but for most people, drinking 1.5 to 2 liters, 3 to 4 pints, of water per day is a healthy target. Drink water all throughout the day to stay hydrated, especially before, during, and after physical activity, or whenever you're feeling peckish. Other beverages, such herbal teas, juices, or soups, can help you stay hydrated. However, steer clear of alcohol and caffeine, containing beverages as they may have the reverse effect. At number 5, we have overusing painkillers. When it comes to your kidney health, over-the-counter, painkillers present a serious risk for long-term damage. The class of drugs which are the main culprit are non-steroidal anti-inflammatory drugs such as Advil, Motrin, ibuprofen, and Toradol, as well as analgesics such as acetaminophen and aspirin. Many individuals use over-the-counter pain relievers to relieve their discomfort, but these medications can seriously damage your kidneys, particularly if you take them frequently or in large amounts, have kidney disease, or both. It's not uncommon for women to consume large volume of painkillers over months to years due to severe menstrual cramps. Those with arthritis, joint pain, or chronic headaches may also consume large quantities over time. Painkillers, both over-the-counter and through prescription, can harm the kidneys by reducing blood flow. We refer to kidney disease brought on by prescription and over-the-counter painkillers as analgesic nephropathy. The kidneys are harmed when certain painkillers are used for an extended period of time, especially when taken in large amounts. Abusive painkillers may be the cause of up to 1 to 3% of new cases of chronic renal failure each year. What steps can you take then to shield your kidneys from painkillers? The ideal course of action is to use them sparingly and never exceed the prescribed or recommended dosage. If you have chronic pain, talk to your doctor about other methods of pain management, but try to keep painkillers to a minimum. Your kidneys will thank you. Number 6 may be a little controversial. Eating too much meat. Animal protein generates high amounts of acid in the blood that can be harmful to the kidneys and cause acidosis, a condition in which kidneys cannot eliminate acid fast enough. Kidney stones, bone loss, muscle atrophy, and chronic renal disease can result from this condition. While protein is needed for growth, upkeep, and repair of all parts of the body, your diet should be well balanced with fruits and vegetables. The dietary reference intake for protein is 0.8 grams per kilogram of body weight per day for adults, depending on age, activity level, and health status. Those who engage in intense exercise may need additional protein. You can increase your intake of plant-based protein sources like beans, lentils, and quinoa in your diet to maintain a balanced and moderate dose of protein. These foods are rich in protein, low in acid, high in fiber, and rich in antioxidants. Bad habit number 7 could be on multiple lists. Eating too many foods. High in sugar. One of the most prevalent behaviors that harms your kidneys is consuming large amounts of sugar in food and drink. Your kidney's ability to function is strongly impacted by diabetes and obesity. Actually, the leading cause of kidney damage in the United States is diabetes. Diabetes can be brought on by an excess of sugar, which makes it harder for your kidneys to remove protein from your body. For this reason, protein in the urine is the first indication that diabetes is harming the kidneys. Sugar is frequently added to foods and beverages that you would not think of as sweet, in addition to desserts. Steer clear of white bread, morning cereals, and sauces, as they are all hidden sources of processed sugar. When purchasing packaged foods, pay attention to the ingredients to keep extra sugar out of your diet. Joining our list at number 8 is another bad habit. Smoking. Sure, smoking isn't good for your lungs or your heart, and is one of the worst habits you can have for your health in general. But did you know that smoking may not be good for your kidneys either? People who smoke are more likely to have protein in the urine, a sign of kidney damage. Smoking also damages your blood vessels, which reduces the blood flow to your kidneys. This can impair their ability to function properly and filter out waste and toxins. Smoking may also increase your risk of developing cancer of the kidneys, one of the most common types of cancer. According to a study published in the Journal of the American Society of Nephrology, smokers had a 60% higher risk of developing kidney failure than non-smokers. At number 9, we have drinking alcohol in excess. Alcohol is a diuretic which can dehydrate you, making your kidneys work harder to maintain the fluid balance in your body. Alcohol also has an impact on the liver, which generates urea, a material that the kidneys filter. Overindulgence in alcohol can lead to renal impairment by causing the liver to generate more urea than the kidneys can process. Regular heavy drinking, more than 4 drinks a day, has been found to double the risk of chronic kidney disease. Heavy drinkers who also smoke have an even higher risk of kidney problems, having about 5 times the chance of developing chronic kidney disease over people who don't smoke or drink alcohol to excess. Number 10 is another habit you have control over: being sedentary. Sitting for long periods of time has been linked to the development of kidney disease. More physical activity is linked to better blood pressure and glucose metabolism, 2 critical parameters in kidney health. Even though researchers are still unsure of the exact mechanism or reason behind how inactivity affects kidney health, it is likely because exercise lowers the risk of obesity and diabetes. two of the main causes of kidney disease, by assisting you in maintaining a healthy weight. Some studies have shown that people who exercised regularly had a significantly lower risk of developing kidney disease than those who did not. It is recommended that adults engage in physical activity for at least 150 minutes a week at a moderate intensity or 75 minutes a week at a high intensity. Directly related is number 11, overtraining. It's crucial not to overdo physical activity. Excessive and prolonged exercise can lead to a disorder known as rhabdomyolysis, which is characterized by the rapid breakdown of injured muscle tissue. Rhabdomyolysis occurs when damaged muscle tissue releases proteins and electrolytes into the blood, damaging the kidneys. They can also damage the heart and, in extreme cases, cause permanent disability or death. You can work with a licensed personal trainer who can assist you in progressively increasing the intensity of your workouts if you want to become more active. Refrain from abruptly increasing the intensity of your workouts and stay out of the strong heat and humidity. If you get excessively dark urine and muscle soreness, make sure to visit your physician. Rounding out our list, number 12 may be hard for some to handle, ignoring urination urges. If you ever delay going to the bathroom while busy, or have to hold it too long when there isn't a bathroom handy, you may be putting your kidneys at risk. When you ignore your urination urges, the urine sits in the bladder longer, allowing bacteria to grow. This could lead to urinary tract infections, which can be painful and, if you don't treat them, can spread to your kidneys and do serious damage. Listen to your body and go to the bathroom when needed. Do not hold your urine in for more than 4 hours and try to empty your bladder completely every time you go. One bonus item that you may not have much control over, but it's important to be aware of: exposure to contrast dyes. It's likely that you have had an MRI or CT scan at some point in your life, possibly numerous times. Although undergoing these scans isn't exactly a daily occurrence, the dye may harm the kidneys. For CT scans, contrast dye may be used to improve tissue visibility. During a coronary angiography, which is used to diagnose and treat coronary artery disease, contrast dye is also injected. Regrettably, this contrast agent can cause acute kidney injury by harming our kidneys. Acute kidney injury affects up to 20% of hospitalized patients and more than 45% of patients in critical care settings, causing a sudden decline in kidney function. You might not need to be concerned about contrast dyes if your renal function is normal. When administering contrast dye to individuals with impaired renal function, care should be taken and a nephrologist should usually be consulted. Your kidneys are vital organs, and it is necessary to protect them. By avoiding these 12 habits, you may be able to improve your kidney health and prevent or delay the progression of kidney disease. Were you aware of the effect these habits could have on your kidneys? Share your thoughts and experiences in the comments below. If you found this video to be helpful, make sure to like and subscribe to more videos like this. Until next time, wishing you the best of health.